Hello, everyone. Welcome to our very first podcast. I'm Jessica.
And I'm Lee.
And we're here to talk to you a little bit about our history, how we got started, the types and prevalence of women's pelvic floor dysfunction. So, Lee, our first podcast.
Yes. It's been awesome so far, right?
It has. It's
well,
been
not
a lot of fun.
I'm sorry. The podcast has not been awesome. The podcast.
So far, I wouldn't change a thing. First podcast ever.
Yes.
Yeah.
Excited.
It is exciting, isn't it?
Yes.
When we think about the first time I met you, we were working together at a physical therapy company. I remember that you were new, you were you were relatively new out of school.
Yes. Probably 3 years.
3 years or so. And so now how many years have you been a PT?
23 years.
23 years.
Yes.
So 20 years we've been friends.
I mean, we're not that old, right?
Yeah. Well, we were 3 when we met.
That's right.
So when you came, where did you come from?
So I came from Grand Rapids area.
Okay.
And before that, Kansas, and then I'm originally from Louisiana. So Michigan was still fairly new to me when I met you.
Yeah. I remember we called you Louisiana Lee.
Yes.
Yeah. It was so fun. And everybody has always loved your accent and asked you, well, where are you from? And, I recognized your accent. And you were always good to say to us from the North, well, no, you have the accent, right?
That's right. Of course, my husband always says, do you hear anyone on TV speak like you? Well, in Louisiana, they do.
Yeah, that's right. Good point. Well, you learned about pelvic floor therapy in college during PT school.
Yes. So we had an elective course our last year in PT school. So that's where I started.
Started and then just built on that from there. And you've had lots of extensive coursework and things like that too, which is really amazing.
Yes. And learned from a lot of the other therapists that I've worked with along the way too, which I almost think is even more valuable.
Oh, yeah, absolutely. So, and then also you, for a while there, when we first met, there was a little project with a urologist that you went and worked in his office and so forth, helping him with some data and things like that.
Yes. And the reason behind that was we tried to market what we were doing to help women with incontinence and pelvic floor issues. But women just really didn't want to come in the clinic for that. They were embarrassed. They didn't want people to know, well, everybody's going to notice why I'm here. So we thought if we do it in the urologist's office, people are more comfortable being in a doctor's setting. And so just very interesting that that's how things used to be. And now here we sit.
Right.
And things are so busy. I think that we could go to the doctors and say, send everyone after they give birth, send everyone, except for we can't say that because we can't treat them.
Right. Yeah. There aren't enough hands. Our therapists would go insane with the amount of busyness that we would have them.
Yes.
Yeah. So interesting. So you brought up a good point. We live near a university that is a research university, has a research hospital. Yeah. And even they, in the town that's bigger than where we live, even they want to have a pre-pregnancy birthing program and post-pregnancy program.
Yes.
Make it mandatory. If you come to this research institution, this big hospital system, they would like every pregnant woman to be in that program, but they cannot even fulfill the need because the pelvic floor therapists there aren't enough.
Right. There's not enough therapists for the number of patient or people in need.
So, I was thinking about this, that what you just said about the urologist, and that if you had it in a clinical setting more than a physical therapy setting, that women were more likely to come. But even at that, there was so much stigma around incontinence and pelvic pain and pelvic organ prolapse and those kind of conditions that are really common to women. But now we're sort of swinging the other way, where there are so many women that are learning that there's help available out there, that the physical therapists that are in existence and in clinics can't keep up with the need. So you talked about the swing of that. I think that's really similar to years back, such stigma around mental illness. And so many people didn't go to get help for mental illness because there was shame and there was embarrassment around, I have a mental illness. I'm just it's going to be my own kind of private secret and I'm just going to suffer with it. I feel like that exact phenomenon is happening with pelvic pain and incontinence and prolapse. Do you think that's what's happening? Is the stigma is?
I do. And I think you're right, because we still have so many people that come in and they truly believe like they're the only one that has the problem, or they don't see it as an issue that everyone suffers with. And so they're a little embarrassed to bring it up, or maybe they've brought it up and they've just been told, deal with it.
Right.
And so then they're afraid to bring it up again and to ask for help for it. But the nice thing that we see now are there are women that build up these communities and they say, I've gone for help for this. I have this problem.
Right.
And so the more people that speak up about it, the easier it is for all of us to talk about it.
Absolutely. And to not be ashamed of it and so forth. I think about if you look at a research institution and they say, let's just look at pregnancy alone. So for pregnancy, they anticipate that incontinence will be a result of childbirth, or prolapse will be a result of childbirth, or pelvic pain can be a result of last trimester all the way through postpartum. If you look at that, if it's that prevalent that a big research institution should say, if you're pregnant, automatically it's an order to physical therapy, then that should help us as women to understand it's more the norm actually than the exception that you'd have these problems.
Exactly. So you wouldn't go have a rotator cuff surgery and not follow up with
Right.
therapy, right?
Right.
That would be unheard of. But also for these women, even if you don't experience an issue after giving birth, use it as a preventative measure.
Absolutely.
So I need my body to heal and return to normal per se, because I plan on having more kids, right?
Absolutely.
So I don't have to wait until I'm done having kids and think, okay, well, just deal with these problems until I'm done, and then I go have it fixed. Like if you know what to do prenatal, if you know what to do labor and delivery, if you knew what to do and pick up with it after the fact, then you can just keep up with these things and keep your body healthy, and you don't end up with a problem when you're done, right? You just know how to maintain, I guess,
And I think
prevent.
Yes. So I think what I hear you saying is if there were access to this kind of care, if women knew about these kinds of programs, then it's not the norm anymore postpartum to have these problems, that we can prevent it if we start during pregnancy, last trimester, or even maybe all throughout pregnancy, or maybe ideally in an ideal world, a woman would get that kind of education, maybe even in high school, how to care for, we do it with brushing our teeth and flossing, right? That's something that you have to establish. And if you want a healthy mouth, teeth, gums, you just carry that through your whole life.
Yes.
Maybe something like that for pelvic health.
Yes. And in fact, we've had one of the colleges in our area ask us to come speak to their college ladies in a health class and just talk about pelvic health care and how your body moves, and to recognize some of these things early on and to speak about them and bring them up and to realize how normal they are. And those have been great. Because a lot of times, no one talked, at least when I was growing up, no one talked to me about it. Did they talk to you about it?
No.
So I wouldn't have known what is normal or what is not normal, or maybe to know when to ask for help.
Absolutely. And again, no one spoke to us because there was such stigma around it. It's like, well, I certainly don't want you to know that I struggle with this. And so I'm just not going to talk about it because probably I'm the only
I've
one.
had lots of patients even say that exact thing. They said,
Really?
I think my mom also struggled with pelvic pain, but she wouldn't dare talk to me about that or say that. And now I'm struggling with this. And it really would have been nice if I would have known she did too, because I would have felt more comfortable with this and been able to maybe take care of it a little bit earlier, right?
Yes.
Yeah.
And, we were even discussing and put into the app about that genetics can be a reason why. So, pregnancy aside, all these other things aside, genetically, if you could have a propensity towards some of these conditions alone,
Exactly.
let alone,
Yeah.
Neat. Well, so we also talked shared some statistics about prevalence of urinary incontinence. And what we found was if you lined 10 women up and you said, okay, let's see how many of these women have urinary incontinence, that 6 of them would step forward.
Yes.
That's how prevalent it is. And I think even at any given point in life, you may have 10 step forward. But I've seen the statistics, I think it's National Institute of Health, says if you had 10, just pick 10 women, just over 6 of them would step forward at any given time.
And that's the ones that are willing to admit it or report it, right?
It's a really good point.
Yeah.
Yes. Okay, so then there's another statistic too. There was a study done and they decided to see what's the incidence of pelvic organ prolapse in women, and then how many women think they actually have pelvic organ prolapse. So they took, I can't remember the number of women. Again, I think this might be National Institute of Health or CDC, not sure which one. But they did the study and they had a pelvic exam. And they found of all of these women that they looked at, 40 to 50% of them had pelvic organ prolapse. But if you looked at their subjective report before they were examined, only 3% of those women said, I think I have pelvic organ prolapse.
Right. And I think a lot of times you're not checked for that unless you maybe ask for it or you're giving the specific symptoms that occur with that. So we see a lot of times with people that come into the clinic, they may have a grade 1 or 2 and they don't know it. And so when they get their first pelvic exam, that's when we're telling them, you have that grade 1 or 2 prolapse. But people are really scared of that word, right? And it is a scary thing to think about. My organs are coming out, so that is very scary. But it's fixable,
Right.
right? And so there's something we can do about it. So we don't have to be scared of it. We just have to know how do we correct this.
Absolutely. Yep. And so you were talking about the grades of prolapse. So a reason a woman might not know that they have prolapse is it is not to the organs haven't descended to the level to the entrance of the vagina or out of the vagina yet. So they don't know, they don't have necessarily that feeling of heaviness or things like that, because although those organs have descended or moved or shifted, it's not to the point where there's a bulge or a real heaviness.
But they could see it on their own, right? Or feel it on their own when they're sitting.
Right.
Sometimes people will say that, like, "Ooh, I feel like I'm sitting on a ball or something."
Something, a heaviness or a fullness is present. Yeah. Interesting. So in thinking about pelvic pain then, so we talked about the prevalence of urinary incontinence, we talked about the prevalence of pelvic organ prolapse, but pelvic pain is a whole nother area that we get into in the app because it's common and so many women deal with that. And I think the statistics on that are about, so worldwide, so the whole entire world, not US women, but in the world, 26% of women struggle with some form of pelvic pain. So for women, one has to step forward and say it's me. And again, I think you bring up a real good point of the ones
how many report it. And I would suggest that number would be much higher. But of course, we're basing that off of women that we see in the clinic. So if you don't have a problem, you're not coming to see me.
True.
But so that may be a little biased, but I do believe there's more than that.
Interesting. And I wonder for you, with your experience and expertise across the lifespan, pelvic pain, is there a certain age or is it no respecter of age?
I don't think there is. I think maybe you start to notice it as you get older. When you're younger, you might not have as many reasons to notice that, but you may start having symptoms. So it may come out as more of a low back pain or a hip pain or an area associated with the pelvis. So we'll see that in teenagers or younger kids that may have a hypermobility syndrome. I see it a lot with very high stress, anxious, maybe what we would say the type A personalities. They're going to have that hypertonicity, and they may or may not experience pain with that. But can you imagine being, a kid that age? You're probably not going to talk about that or bring that up.
Right.
So,
well, and again, even if you were to, I like what you said about sometimes your back might hurt, or even you might think you have a hip problem, but
Yes.
actually it's that core, it's that base that is either hypertonic or it has too much tone to it and it doesn't relax appropriately. It can be adhesions that are in the pelvic floor and things like that, but you could actually experience that in the hip and think, oh, I hurt here, or even my low back or whatever. So
Yes.
I think you being a pelvic floor physical therapist, if I came to see you and I had hip pain, you would really be easily able to help me discern where that's coming from.
Yes. Or if you come in and you say, my child has chronic constipation, I, may also say, ooh, I wonder if we have some tightness within that pelvic floor and some issues there too.
Yeah.
And so a lot of it does just come with them talking to you and telling you their history. But like we said before, the big thing is just getting people to come in and talk about it,
Yeah, and to not be embarrassed. Okay, so we talked about several reasons for doing the app. One was because we're starting to see such a swing of women wanting help with their pelvic floor that we couldn't keep up with the need. And our clinics span across 3 counties, right?
Yes.
And just can't, if our big research system that's in a city not too far away can't keep up, how in the world can rural America try to keep up with that?
Right.
And so that's a problem too. But we also talked about the one big thing that drew us to designing the app and having it available is that we could not possibly keep up with the
Yes.
need. It's just, even if we had the hands to do it and the therapist to do it, the need is still greater. I mean, it's so grateful that the stigma is starting to crack.
Which is wonderful, because that's what I mean. We could hire as many therapists as we already have on our team, and we still wouldn't have enough for the need
Absolutely.
that's out there.
Right.
It's just impossible. And so that's what led us to this.
Yes. And although that stigma is cracking, there are still, even generationally, maybe it's not just generational, but there are still women who are so shrouded in shame and embarrassment that, like, I just don't want people to know, let alone tell my OBGYN or my primary physician. I'm certainly not going to go to therapy for it. So when you design an app that somebody can look at in the privacy of their own home, they can study the charts, they can look at the symptoms, they can bop back and forth and just kind of learn about the different conditions. They can take the quiz, which one should I do first, which second, so forth and so on, is important, that they can just either grab their phone or their computer and they can get help. Nobody has to know if you don't want people to know.
And I think that's going to be super helpful and a good place to start, because so many people are afraid. They've already built up the courage to tell their primary physician or their OBGYN about this. And then here they're told to go to physical therapy and they think, physical therapy? Is there physical therapy for this? What in the world are they going to do to me?
Right.
And they come in and you just see that fear in their eyes, and just trying to get them to relax and tell you and to have the courage again to discuss this. And it's just so much unknown for them. So I think this is going to be helpful in giving them some of that education and letting them get started and get relaxed a little bit, know some of the things that are coming, and maybe even solve their problem. And if not, then when they go into physical therapy, they already know a lot about their condition, which to me would make you feel a little bit more relaxed.
Yes. Yeah. Less shame because you know the prevalence of it. You already have an idea of what your anatomy even is, that the conditions that do exist you're aware of. You've already started some exercise. You have some awareness of your posture and things like that. You have some awareness of how to relax. You have some awareness of how to strengthen. And so.
And you've become a part of a community where everyone is having kind of the same problems or the same issues. And so you realize, I'm not alone in this. I'm not the first person that has come in here and had to tell this lady all these things,
Yep. You can ask your most embarrassing questions at the
Yes.
community chat.
Yes.
Nobody has to know who
you
Jessica is.
Yeah.
There are a million Jessicas. People probably know. I can type or if it doesn't,
Or if it were me, I would say I'm Jessica and tell my problems. And then they would think it's you.
Either way, you get the help you
I
need.
used to say that to patients. If you are not happy with your care, then just tell them your therapist was Jessica. Except for Except for then they would always say, well, actually, I had a therapist with the accent, and there was only one
Oh,
of
yeah. See, there you go. Brunette didn't work. You could have said curly hair. Yeah, gotcha. So funny.
I'm not sure if
Yeah.
you knew I did.
So I think this too, I'd like to say about the app. It is not physical therapy. So the app that you're
Right.
getting is not physical therapy. So if you do the app and you're one of the small minority, 10% or less, that does not improve, and we're confident of that based on what you've seen in the clinic and you know to be helpful, you can know that there are things that a pelvic floor physical therapist can do that our app can't.
Yes, very much. And that's kind of another reason, I guess, as a therapist in the clinic, a biggie for me of what someone gets out of this app is that you got good quality information. And if I'm the therapist in the clinic, my goal would be I can help a lot more people and I can get you in and out a lot quicker if you have this background and you have this knowledge and you already know how to breathe and you already are aware of your body and where it is in space and you're already starting to move well in the different directions. It doesn't matter which thing you're coming in, you're way ahead of the game. And there's some things as therapists, and not just with the pelvic floor, but anything, any diagnosis that comes in, and they'll come in and say, well, I looked this up online, and we kind of cringe and go, oh gosh, what did they find? And is this going to be good or is this going to be bad? And it's not always bad. But that was one of my big goals is I want to provide information that when this person comes into therapy, if they have to, that the therapist is very grateful that they have learned this and it's giving them a head start and that they're not cringing because they got misinformation just from a random place, right?
Yeah. So are you saying that there's some information out there that actually could set a person back? Or
Yes, and that's kind of the Kegel thing, right? There's so many things out there, and even they're being told sometimes by their doctors, well, just do your Kegels. And that's not always the answer.
Yes. Or being told there's nothing you can do about it, all women suffer. And so walking away without any solution. I
Right.
know that that's a case that's happened before too, just even in from our
Just being
experience.
totally disregarded and, have pain with intercourse, well, take some pain meds.
Yeah,
Yeah.
absolutely. Yeah. Well, I'm super excited to see what this will produce, what this will, how many people this can help, who it will help. Can you imagine that we'll get to hear stories and,
Yes. And that's the most rewarding thing on our end, right? And I guess if there's a selfish reason for that, and for physical therapy in general, it's the most rewarding job, and that you get to see people come such a long way, and that's what this is about. Yeah.
Yeah, absolutely. Well, excited. It's been a lot of work. It's been a long road, but I always say if you're anything that you do, if you're doing it for the cause of people,
Right.
there is no greater thing than to help your
Right.
fellow, woman, man, whatever. But if you spend your life in purpose and in cause for people, it's never
There's
wasted.
no better feeling.
Yeah,
Yeah.
and nothing, it's never lost.
Right.
That work is never lost. So thank you for how hard you've worked and poured in. I so appreciate it, in your brain, your brilliance. I'm just so excited to be working alongside you and get to
Well, thank you.
steal from your brain, even though you tell patients if they're not better to say that Jessica treated you.
That's
I'm
right.
still really grateful to working alongside you. It's trouble.
Only every now and then.
And a big thanks to you, our listeners, for tuning in. If you enjoyed this episode, be sure to subscribe for more episodes. We want to deep dive into these topics and many more as we unpack and normalize stigmas around women's health. For more information or other ways to get plugged into our community of women clothed in strength, dignity, and who can laugh at the days to come, be sure to check out our website, which is pelvicare.com, or you can download the app. So we'll see you soon.